MR-HIFU hyperthermia for primary rectal cancer, a virtual feasibility analysis. MR-HIFU uses an external transducer to focus a beam of ultrasound energy into a specific target site in the body. For this study, the target site was rectal tumors. The beam results in rapid, localized heat deposition. Mild hyperthermic temperatures improve tumor blood flow and reoxygenation, which in turn enhances the cytotoxic effect of radiation and chemotherapeutic drugs. This is a non-invasive outpatient modality. Our primary objectives were to create a workflow and software solution to virtually simulate primary rectal cancer patients and determine the feasibility of utilizing MR-HIFU hyperthermia. Part 1 was a retrospective patient analysis. We identified patients diagnosed at Sunnybrook Hospital over a 5-year span. We retrospectively analyzed 105 patient files. The diagnostic MRIs were reviewed to record and measure tumor and surrounding organs and structures. MR images were retrospectively analyzed to evaluate the rectal tumor at diagnosis. The size, location, and association of the tumor with respect to surrounding structures were used to determine tumor targetability by MR-HIFU. The hospital PACS measurement tool was used to record and measure tumor and surrounding structures. The measurements taken for each patient were as follows. On the axial plane, distance from skin to near tumor edge, tumor center, and far tumor edge, thickness of muscle and fat in the beam path, distance from tumor edge to far and near field acetabulum, tumor edge to coccyx and organs at risk, and the width of the sciatic notch. On the sagittal plane, the distance from tumor to coccyx, bladder, bowel, and prostate, uterus, and ovaries was measured. Part 2 is a virtual treatment planning. We imported 30 10 high, mid, and 10 low rectal tumors into the Horos software to Tumour Delineation. We used a Python script to rotate and import images into Sonolive, where we virtually targeted the tumors. We then used an additional Python script to extract data and create 3D renderings of tumor and treatment cell overlap. For Horos Tumour Delineation, the tumor was outlined pixel by pixel in each image slice. A contour GTV 3D image was created for visual and metric representation, as seen in the bottom right-hand corner. For Python image rotation, the DICOM image sets with tumors outlined from Horos were imported into Sonolive. A Python script was used to recenter images to the MR-HIFU system bed to mimic real patient setup. Images were examined to determine if transducer rotation would be sufficient or if further patient rotation would be required. If further rotation was required, the DICOM files were re-uploaded to the Python notebook to simulate a hypothetical patient rotation. For the virtual treatment planning, since this is a retrospective analysis, these were virtual simulations only. No patients were physically on the MRI bed, and therefore no heating was applied. The available treatment volume, it's seen in blue, is highlighted on each plane to show the possible extent of treatment cell positions. The ultrasound beam, shown in yellow, was placed to ensure the beam clears both the acetabulum and the coccyx in each image slice and plane. The planning target volume, shown in pink, is superpositioned on the outlined tumor, giving an approximate tumor volume. And lastly, in green, we see an 18 millimeter treatment cell, which is placed in the center of the beam path covering tumor and PTV. The Python notebook uses a PyMesh library to calculate the treatment cell volume, the GTV volume, and the intersective volume between the treatment cell and the GTV. The MR-HIFU virtual treatment planning and analysis was first performed with a single treatment cell added and then repeated, allowing for multiple hyperthermia treatment cells. On average, 2 to 4 cells were added. When multiple treatment cells were added, we saw the coverage increase from 13.1, as shown in figure A, to 41.1, shown in figure B. Of the 105 tumors analyzed, 50% were mid-rectal tumors, 34% lower, and 16% upper tumors. Of the 30 virtually simulated tumors, 9 of 10 lower, 7 of 10 mid, and 1 of 10 upper rectal tumors were targetable by MR-HIFU. An average of 24% of lower and mid-rectal tumors were in the direct hyperthermia beam path with one single cell. When multiple treatment cells were added, the hyperthermia beam coverage significantly increased to 47% and 38% in lower and mid-rectal tumors. This is the first virtual analysis to evaluate MR-HIFU hyperthermia targetability in primary rectal cancer. Lower and mid-rectal tumors are targetable by MR-HIFU, while upper rectal tumors are more difficult to target due to depth and position of tumor. We created a workflow and software solution for virtual pre-treatment planning. This potentially improves patient selection for MR-HIFU by reducing time for treatment setup, planning, and cost. Virtual MR-HIFU hyperthermia treatment planning is feasible and can be used in future studies. Thank you.